Most women think that hormone replacement therapy is just for menopause. But believe it or not, the best time to start is actually perimenopause. And let's talk about why. I'm Dr. Jen, double boarded OBGYN in integrative medicine. So I help women every single day in my private practice called Precision Health, women in perimenopause and menopause to feel great now and in the future. I love talking about things like longevity and healthy eating and how to feel good. And I myself am a woman in perimenopause. I started my symptoms 2 years ago, and I've been helping other women try to figure out what's a great blueprint for them. So let's talk about how to start hormone replacement therapy in perimenopause. So first, I want to say that it's very common that a patient will go to their doctor and say, well, I'm experiencing depression, or I'm experiencing hot flashes or insomnia, or just having these symptoms, and their doctor will say, well, you're not in menopause yet. Wait until you have 1 year without periods, and then we can start hormone replacement therapy. But that is actually based upon old guidelines where we used to sort of think that hormone replacement therapy was only for menopause or post-menopause. But in reality, perimenopause is a transition. It can be up to 10 years before menopause, and you can start experiencing these symptoms because your hormones are actually declining. So there's not a rule or a guideline that says you have to wait until menopause. It's just what we were trained as physicians. And now we're understanding so much more than we used to. And we now know really this is a continuum. And I'm going to talk about the difference between birth control and hormone replacement therapy in a few minutes. So stick around for that. Okay, let's dive into why someone would start hormone replacement therapy. So number one reason would be symptoms. So typically someone will have low progesterone because progesterone is the first hormone that starts to be affected by perimenopause. So when you don't ovulate every single month, then you start losing progesterone. And progesterone is the hormone that is calming. Think about progesterone calming. And in this graph, I'm showing you here what happens with hormones. You can see progesterone kind of declines over time. Estrogen kind of goes in a roller coaster fashion, and testosterone also declines in kind of a linear fashion. But progesterone is the hormone that most people recognize first as causing their symptoms. And those symptoms are difficulty getting to sleep, difficulty staying asleep. You wake up at 4 o'clock in the morning and your brain is already turned on and ready to go, and you're coming up with the to-do list, and you've thought about, did I lock the door before we went to sleep? Does the dog need to go out? Your brain just starts racing all the time and waking you up, usually between that hour of 3 to 6 a.m. So getting to sleep, staying asleep, calming the brain. Progesterone works at the GABA receptors in the brain to calm you down. So women will often notice, I feel more anxious, irritable, annoyed, oh my gosh, my husband is breathing too loud. That coworker is pissing me off. I'm frustrated. It just feels like everything is a trigger. You have a very short fuse because you don't have that relaxing portion of the hormone. Also, heart. So women get heart palpitations. That's a very common sign of low progesterone. And there are several more, but those are kind of the basics of what low progesterone feels like. Then when remember estrogen kind of goes in a very roller coaster fashion. When estrogen starts to decline, women notice brain fog, hot flashes, night sweats, memory issues. Why did I walk in this room? What's my neighbor's name? What's that kid I went to high school with? What's that kid's name? They'll notice dryness issues, dryness in the skin, the face, wrinkles start appearing, the face feels really dry, dry vagina, very much an estrogen issue. So anything bladder and vagina is estrogen. So urgency, feeling like you have to go to the bathroom a lot, recurrent UTIs, vaginal infections, dryness issues, all estrogen. And then testosterone and I will say estrogen also plays into libido, but libido is complicated in women. And honestly, I did a completely separate video on libido because it is really complicated. But testosterone is definitely something associated with libido, energy, focus, kind of vitality. We describe this as a vitality hormone. So women who have low testosterone will often say, well, I have brain fog, low energy, no interest in sex, so low desire, and sometimes even feeling like they're losing muscle mass. They're going to the gym, they're lifting weights, but seems like it's soft and nothing's really happening from a muscle. So that is very much a low testosterone symptom. So women will take hormone replacement therapy in perimenopause because they're starting to experience symptoms. Now, that's not just the reason that you can take hormone replacement therapy. Some women take it because they have medical conditions. They may not be experiencing symptoms like hot flashes or night sweats. This is actually what happened to me. So I was on progesterone because I was already perimenopausal and age 46. I'm 48 now. And I actually developed a frozen shoulder. And if you've had frozen shoulder, you know it is miserable, incredible pain. I went to physical therapy for 4 to 6 months. I could not lift my arm above my shoulder. And I started estrogen, not for hot flashes, but specifically for helping me with frozen shoulder because my pain was just so incredible. And within a month, I felt so much better. So I've continued on estrogen therapy just for that particular reason. So medical conditions that might, maybe you developed osteoporosis and you're in your 40s and you want to use hormone replacement therapy like estrogen to help with that particular condition. Now, remember, those are indications that aren't necessarily on the list of FDA approval for estrogen. For example, you're not going to see frozen shoulder on the handout on an estrogen prescription, but that doesn't mean that it's not useful and that there's not indications, but it might be that you definitely need to talk to your provider about whether or not that's an option for you as well. Third might be longevity. Longevity is something that more and more women are looking into. In fact, Dr. Lisa Monscani wrote a fantastic book about how valuable estrogen is for the brain called The XX Brain. And then The Menopause Brain, she wrote both books. And we're starting to really understand now the value of when you lose those hormones, how that affects multiple systems in the body. Now, the research is still really kind of not as robust for sure in this area, but it is taking off. And in the future, we'll find that, there may be indications for estrogen for brain health, bone health, muscle health. But right now, it's those indications are not there. But it could be a reason that you may be starting hormone replacement therapy. So we talked about the why you would start hormone replacement therapy. Now let's talk about the how. How would it be prescribed? I want to make a comment about birth control versus hormone replacement therapy. And I did do a separate video, which you can check out here on HRT versus birth control. I personally do not prescribe birth control pills for perimenopause because of a couple things. One, birth control is kind of a one size fits all, meaning everybody's on the same pill, right? There are 90 different birth control pills, but in reality, you're on kind of the same combination of estrogen and progesterone. It's not personalized. It's not individualized. And you can't separate and give someone, say, progesterone only for sleeping issues and separate the estrogen. So in my mind, birth control is really for birth control's sake. So if you're in your 40s and having perimenopause, you can still get pregnant. And so birth control is maybe the right choice for you, but you want to talk to your doctor specifically about that. Okay, let's move on to the how to prescribe hormone replacement therapy. So this is also not a one size fits all. Every woman is very different. Every woman has different symptoms. My perimenopause symptoms may be very different than yours when you start perimenopause. So the very first thing you need to do is understand what are the symptoms that you are suffering from and that you want to change. So I love when women bring in a symptom checklist. And in my course that I've built, I actually have a symptom checklist specifically to try to help people narrow down what it is that they're experiencing. Is it perimenopause or not? And symptom checklists are great because it helps us understand as providers what hormones make sense. So, for example, you're 47 years old, or let's just give it a patient example because I love talking about the success stories for my patients. So I had a patient, we'll just call her Amber. At the time when I met her, she was 47 years old and she was having difficulty with getting to sleep and staying asleep. So she would sit there for hours and just think about anything she could do to try to fall asleep and could not fall asleep. And she would wake up frequently throughout the night, 2 or 3 times during the night. And if anything happened, like the dog barked or the lights were on too bright, she could not get back to sleep. It was like she was so sensitive to every single noise or thing going on. The other thing she told me was that she was feeling very irritated. Like she yelled at her children for things that she typically doesn't get upset about. So she was very irritable, annoyed, found herself kind of screaming at her kids, screaming at her husband, and really felt like this was not her personality. She'd never been like that. She'd been a very calm person. She did not have hot flashes, night sweats, vaginal dryness, low libido. All of that is not an issue. So with that particular patient, we started progesterone because remember, progesterone is the hormone that calms you down. Her cycles had just also started to change to where she was starting to notice that she would have like 45 days, sometimes 60 days between her periods, and her cycles were starting to space out. Also signs of low progesterone. So I started her on oral progesterone to help her sleep. I used the FDA-approved product, Prometrium. And within a week, she was sleeping and staying asleep because that progesterone, again, works at the GABA receptors in the brain to calm the brain down. It helped with anxiety, helped her feel less irritable, basically. So typically, I start with asking the symptoms for the patient and then targeting the hormone replacement therapy depending on their symptoms. So had Amber said, I'm also having hot flashes. I'm also having night sweats. I'm also having vaginal dryness. I'm also having, skin changes. Then I might have added estrogen in that particular case. The reason why I tend to prescribe progesterone and then estrogen if they're starting to experience estrogen-like symptoms and kind of step those into there, because if you give someone estrogen, for example, and they're not needing it yet because they're not there, then they could experience symptoms of high estrogen. So if I had given Amber estrogen and she was not ready for it, then remember that roller coaster effect? When she's on her high peak, she'll even feel worse. So she might have symptoms of too much estrogen, which could be breast tenderness, acne, weight gain, retention, almost like fluid weight gain, feeling very moody. So kind of like when you were 15 again and you were like, why did my friend not call me back? That kind of irrational moodiness. We've all been there. And so for her, I chose to just start with the early perimenopause type protocol. And then when she gets to the point that she starts noticing estrogen, low estrogen type symptoms, then we'll add estrogen onto that. I do tend to also get blood work because, no, I don't get blood work to start hormone replacement therapy, but I will get blood work once someone is actually on hormone replacement therapy because I want to know what ranges that they are currently at. And if it's someone is in perimenopause and still having cycles, we try to time it specifically to where she is in her cycle. So we check blood work, timing wise, because the estrogen and progesterone are not the same throughout the cycle. So in perimenopause, how I start hormone replacement therapy is first asking, what are their symptoms? Then knowing their symptoms, pairing, do they need progesterone? Do they need progesterone plus estrogen? And do they need progesterone, estrogen, and testosterone if we need to go there? I always get blood work before I do testosterone because it's very important that you don't give someone testosterone and it goes down the wrong pathway and then they end up having side effects like hair growth. So it's important to definitely get blood work before testosterone, in my opinion. So in perimenopause, someone could be on a combination of estrogen, progesterone, testosterone. They could be on any of those combinations depending on what symptoms they're having. So in summary, basically, in perimenopause, because it is a transition and because things do change, then you want to individualize their treatment and base it on the symptoms that someone is experiencing. Lastly, I'll say that the route is also very different, right? Not everybody chooses a patch or cream or ring. There are a lot of different options for hormone replacement therapy. And I do prescribe both compounded and FDA approved medications because I, in particular, think that there are some uses for compounding, such as compounded testosterone, but I do have a good informed consent with every single one of my patients about all of the options. Lastly, the route of what I use. So if I use a patch or cream or ring or what options, there are a lot of different options. And if you're interested in learning more, check out my next video, which is about a doctor's guide to hormone replacement therapy, where I go over all the different types of hormone replacement therapy based upon the different hormones, and you can see the options that I use. And I do use both compounded and FDA approved medications. If you love this video, please like and subscribe. Please share this information with other women who are in perimenopause and menopause, and give me some ideas about what you're looking for, topics specifically. Put them down in the comments. I am happy to make videos about those specifically, and I love providing this content.